Before I come into the patient's room, I check the order from the doctor for this particular patient for the nasogastric tube. And I also gathered all my supplies. So I go into the patient's room and I'll introduce myself. Hello, my name is Alina. I'm your nurse today. Could you please tell me your date and your name and date of birth? All right, this is the right patient in the right order for the nasogastric tube. What we're gonna do, we're going to I'm gonna raise your head of the bed, and we can, every time you swallow the water, I'll give you water, and I will be slowly inserting the tube into one of your nares. Do you have any questions about that? Okay. So I close the curtain for the to provide privacy. I raise the bed for better body mechanics, and I raise the patient's bed, high fowler's position, so they're sitting upright. I put the pillow behind the patient's back, and I will be asking you to put your head back, to tilt your head back. Thank you so much. I will wash my hands, and I will hand everything to my patient. First of all, I'll check the nares for patency. Do you breathe with anyone better than the other? And you breathe well? Okay. So I'm going to insert the nasogastric tube into your left nare. And I will provide the basin for the patient. And I'll also provide tissue for the patient in case they need it. And here's the cup of water. So once I start, I will ask you, once I start, if you feel uncomfortable, could you please raise your left hand, just so, and then I'll stop. Also, I will cover the patient with a drape, so you don't get anything on them. Next, I will cut the tape about 4 inches, and I'll cut it in half in longwise. Tape it here because I'll need it later. I will put on my gloves, and if the tube is plastic, we will put it for 10 minutes into the warm water, to make it softer. If the tube is rubber, we'll put it for 10 minutes into the ice to make it more dense. So you'll tilt your head back, and I will open the package away from me. I will take the tube out, so the tube is prepared and ready to go. I will bend it around my finger to make it more go more smoother, and there it goes. And so every time when I'll be advancing, every time I'll be inserting, I'll be turning it. Next, I will measure the tube from the tip of the nose to the earlobe to the xiphoid process right here, and then I will mark it here, so it cannot go further than that into the stomach. And I will put the tape here, just so I know it doesn't go further. And then I will lubricate the tip of the tube, and we will start the process. So I will ask you to please start drinking your water, and every time you swallow, I will advance the tube. So I will do it a little bit. Tilt your head back. Okay. And can you open your mouth? mouth, please. Okay, very good. And now please start drinking water. Okay, keep drinking, and every time you drink, I will advance 2 more inches very slowly. Alright, so we got almost close to the where I measured the tube. Now I'm going to check if the tube is, and I'm going to kind of like secure it on the patient's nose right here. I'm sorry. I have to do this. Okay. And now I'm going to check if the tube is in the correct place. I'm going to check it with pH stick, or I'm going to order the x-ray. And the tube is in the stomach, and so once I know it's there, I will advance about 2 more inches more. Okay, and now I will secure it with a tape, with that cut, and then I'll secure it on the patient's cheek right here, unless it's ordered otherwise. I also have a measuring tape, and I will measure how far it goes to, from the nose to the connection, and then I will start the suction. And with that, I'm going to write everything down. The measurement here, the measurement at the nose, how far it's from the connection, and date and time, and I'm going to initial here everything, and once I'm done, I'm going to clean everything out, clean all my supplies, retrieve from the patient, and take my gloves off. I'm going to wash my hands. After procedure, I'm going to lower the patient's position back to 30 degrees. Unless the doctor states otherwise, I'm going to lower the bed, give the call bell light in case you need anything. I'm going to open the curtains back out, and once I'm out of the patient's room, I'm immediately going to document all the measurements and how the procedure went and which nurse I put in the nasogastric tube, and basically that's it.